This is a recording of a standard patient monitor. This is one from an anesthetic machine during a case, but the ones you see in intensive care will be variations of the same. The top green waveform is the ECG and the large number is the heart rate. You can set up where you want the heart rate to be read from the monitor. So in this case, we have used the heart rate derived from the arterial line to minimize artifact from diathermy when the surgeons are operating. The red trace is the arterial line trace. And the numbers in red are the arterial blood pressure in millimeters of mercury, and the brackets are the mean arterial pressure. The yellow trace is oxygen saturations, and the number 98 is oxygen saturation in percentage. The white box-like trace is capnography, which is carbon dioxide monitoring. There is a little ET that says 4.9 and a FI that says 0.0. The ET is the end tidal carbon dioxide level, and that is the amount of carbon dioxide in kilopascals detected by the monitor at the end of an exhalation. Do watch our capnography video for more information about capnography. The FI in this case is fraction of inspired carbon dioxide. It is 0 because the machine is absorbing carbon dioxide from the breathing circuit using soda lime. Number on the right is temperature, and that's T1 in degrees Celsius. In this case, the temperature monitoring comes from an esophageal probe, but it can be esophageal, oral, axillary, nasal, and sometimes even urinary catheter-derived temperatures. The bottom box on the left is manual blood pressure, or non-invasive blood pressure. The anesthetic machine monitors allow for monitoring of anesthetic gases. So that is what the AA in percentage is underneath the saturations trace. AA stands for anesthetic agent. In this patient, we are using total intravenous anesthetic, so we are not using any of the gases. Therefore, the numbers are all 0. In ICU monitors, there usually isn't any AA waveform, as we almost never use anesthetic gases in that setting. Depth of anesthesia using anesthetic gases can be determined by end tidal and fraction of inspiration of specific gases, which is again denoted by ET or FI. So the last box on the bottom right gives you the end tidal and FI fraction of inspiration of nitrous oxide in light blue and the anesthetic agent, as well as the MAC or the minimum alveolar concentration relevant to anesthetists who use this for depth of anesthesia monitoring in theatres. The mix of pure oxygen and air in percentage is shown in the balance box, which is the third on the bottom right. It's 55%. The SPV and PPV are pulse pressure variation. The machine uses a mathematical formula to determine the pulse pressure from the arterial line trace, and this is an index of cardiac output. Finally, the last box monitors ventilation in case your ventilator screen malfunctions. It gives you the peak airway pressure, which is 14, total PEEP, which is 3, both in centimeters of water, and it also records tidal volume on expiration, which is 506 mils. You can program the monitor by setting up alarms, what waveforms you want displayed, by touch screen pressing the buttons on the lowest row of the monitor. Pressing trends will give you the recorded values for every 3 to 5 minutes of the patient from the time it was last reset. Some machines will allow you to print waveforms, and if you want to start a non-invasive blood pressure reading, this is where you press Start NIBP. For it to automatically cycle recording, you press NIBP Auto. If you're looking to zero your arterial line or your central line, press 0 all pressures. And finally, most importantly probably, the yellow box on the bottom right is for silencing the alarms.